All right, now here we go. Let's look at grapefruit essential oil. That's actually one of the flavoring essential oils inside my cosmetics that people love. We have a grapefruit vanilla flavor essential oil for scent and aroma. But let's look at the grapefruit extracts. Did you know grapefruit extract by itself has studies showing that it displayed antimicrobial properties against potentially harmful bacteria like staph? Anybody know anybody with staph infections? Staphylococcus aureus, Enterococcus facilis, and E. coli. Wow. Well, this is amazing. One study comparing 5 essential oils found that grapefruit essential oil was one of the most powerful in regards to its antimicrobial effects against MRSA, MRSA, one of the worst bacterial infections you can ever get. A group of bacteria that's usually harder to treat as it's often resistant to common antibiotics. But it ain't resistant to grapefruit extract. Would you like to see, and grapefruit extracts in our cosmetics, would you like to see what MRSA looks like on the skin in case you're wondering, well, how does this apply to anybody I know or myself? Here's a MRSA infection on the left hand of the person on the far left compared to the normal hand on the right. Just so you know, MRSA also can get in the legs and make the legs puffy, red, seeping, just like you see on the left hand there in that image. MRSA also looks on other parts of the body, looks like what you see there in the middle and on the far right of the screen. Anybody know it's been diagnosed with MRSA, you should be known and told grapefruit extract should be considered. It's actually in our treatment cream. A test tube study examining properties of 60 essential oils found that white grapefruit essential oil had antibacterial effects against H. pylori, which creates massive amounts of digestive problems. If you're diagnosed with H. pylori, ask your doctor if grapefruit essential oil is right for you. Research shows that grapefruit essential oil may be effective in fighting certain fungal strains as well, such as Candida albicans, a yeast that can cause infections in humans, especially in people with weakened immune systems. If you're on steroids or antibiotics, you have a promising side effect of growing fungi in your body, including Candida. Grapefruit extracts also known to treat acne. One test tube study monitoring the antibacterial activity of 10 essential oils against what is called the bacteria that causes acne, a bacteria commonly associated with the development of acne. Researchers concluded that grapefruit essential oil does have some antibacterial activity against P. acnes. However, this activity was not as potent as other essential oils tested, such as thyme, THYME, and cinnamon essential oils, for those of you who are wondering. The best acne treatments and creams, according to the U.S. News, these are the 2 most common prescribed over-the-counter products for acne. Differin is number 1. Neutrogena is number 2. Let's look at Differin. Differin is used to treat severe acne in people who are at least 12 years old and older. Its generic name is adapalene topical. These are some of its serious side effects of Differin: burning sensation or stinging of the skin, and this is severe. Dryness and peeling of the skin, itching of the skin, redness of the skin. Those are the more common side effects. And then worsening of acne, especially in the first month of use. Well, I don't know about y'all. Acne was demoralizing to me as a teenager. I would never want to take anything that would make it worse. I don't care if it was a day, a week, a month. It's horrible. Differin has a side effect. It's more common during the first month to see worsening of your acne. But these are the very common side effects of Differin. Very common. This means 10% or more people are going to get persistent pruritus. Do y'all know what that is? That's 74% of all people that use it. It is a severe redness and severe itching of your skin. You'll see pruritus definition at the bottom of the screen for you. That's 74% of all people that use that drug over the counter. Persistent burning or stinging in up to 71% of people. Erythema, redness of your skin for 60% of all people that use it. Permanent red skin. You ever seen people with really beet red faces who've had acne or pimples? Their whole face is now beet red. It's not just red spots where the pimples are. That's erythema. 60% of all people. Scaling, that's peeling of your skin. 60% of people. Pruritus, the itchiness. Dryness, pruritus immediately after administration in 30% of people. Skin stinging, 22%. Sunburn, skin irritation, in 1 to 10% of all people. Up to 1% of all people can have contact dermatitis as a result of side effects, eczema, dermatitis, skin swelling, and acne flares. And then allergic dermatitis and skin discoloration has been reported after trials have been completed. Now let's look at Neutrogena's. Neutrogena's main ingredient is benzoyl peroxide. You can see some other brand names of it. Acne Foaming Cream Face Cleanser, Acne Clear, Benzac AC Wash, Benzac. You'll see there's 100 different brands. I'm not opening up that tab to show you all of them. Benzoyl peroxide is one of the most common ingredients in all over-the-counter acne medications. Benzoyl peroxide topical for the skin is used to treat acne. You see at the bottom of the screen. Serious side effects include pain, burning, blistering, changes in color of skin, dryness, itching, peeling of your skin, redness, scaling, it's called psoriasis, stinging or swelling of the skin where the medicine is applied. These are your less common side effects. Serious side effects, they mention up there, it may cause some very unwanted effects, although not all of these side effects may occur. If they do occur, they need medical attention. Very common skin reactions. 10% or more people using Neutrogena with benzoyl peroxide are going to experience peeling of their skin and really burned redness looking of the skin. Up to 10% will experience dryness, severe itching, and contact sensitivity issues. And less than 1% will have burning sensation. Frequency, they don't know yet just exactly how many percentage of people have contact dermatitis, but that's awful if you've ever experienced. And then swelling of the face has been reported. Nobody really likes that, I don't think. Nobody wants a more swollen face. But those are some of the more common over-the-counter medications. You don't have those side effects with the essential oils. This is why we wanted to highlight these for you. You have alternatives. A review on the efficacy and tolerability of tea tree oil for acne. And tea tree oil is in both our cleanser and our treatment cream for acne. That's what they were designed for, but they can be applied for any skin conditions ever. Eczema, hives. If you have skin cancer, I would even recommend using them. I'm not joking. Almost every ingredient in essential oil is anti-skin cancer. It's pretty amazing. So let's dive into this study about tea tree oil and acne, just to help drive this home, how beneficial these essential oils are. Tea tree oil. Early study on Melaleuca plant, which is the tea tree oil plant, reveals strong antimicrobial, antifungal, and anti-infective properties, which accelerates its use in dermatological and cosmetological preparations. In a study by Fanblatt, 35 patients, in which 10 were untreated and 25 were tea tree oil treated, were subjected for the treatment of furunculosis. Furunculosis. I don't have a picture of that. I'm sorry. You have to go look that up. The scientists used tea tree oil and reported that the incidence of incision on the infected site was reduced. 5% tea tree oil gel observed to improve acne lesions. However, the onset of action in the case of tea tree oil was slower, but it was effective. In a single blind, randomly comparative therapeutic clinical trial, effectiveness of 2% only tea tree oil lotion was compared with 5% zinc sulfate. 47 patients with acne vulgaris were randomly divided into two groups. Group A used the tea tree oil lotion, and Group B used the 5% zinc solution. 2% tea tree oil lotion was found to be better remedy in treatment of acne vulgaris and was much beneficial than the 5% zinc sulfate. Now, this is directly out of the research study. There should have been a word, was much more beneficial than the 5% zinc sulfate. All y'all remember that. Tea tree oil outperformed, and it was only 2% tea tree oil. It was 5% zinc sulfate, which is used for acne treatment by dermatologists all over the world. Tea tree oil beat it. Two double-blind investigations were carried on 60 patients suffering from mild to moderate acne. Patients were divided into three groups. First, treatment with cream containing 20% propolis from bees. Shout out to Dr. Jana Schmidt. 3% tea tree oil and 10% aloe vera. The patients that were treated with the tea tree oil, aloe vera, propolis, and erythromycin cream significantly showed high reduction in papules and scar lesion after 15 and 30 days. Now, they did it for 15 days and 30 days and wanted to see how much better was their improvement in their acne. Tea tree oil, aloe vera oil, propolis, and a drug called erythromycin, an antibiotic cream, all of them significantly showed high reduction in the amount of pimples and zits on the face. But wait till you read about erythromycin, the acne drug. All right, here we go. Tea tree oil gel and face wash for the treatment of mild to moderate facial acne. 18 participants enrolled for the study. The author found the average total lesion count was 23 pimples at the beginning of the study, was the average. And then it was 17 at 4, 17 pimples at 4, 15 pimples at 8, and 10 pimples at 12 weeks. The product was found to be well tolerated with no serious adverse effect. Tea tree oil has multiple natural advantages, yet some of them are being used by the industry. In the previous study of Revival, it is used cure-all agent is what they call it. Tea tree oil properties and the therapeutic approach to acne. This is where we're going to dive into some very specific things because I find it exciting. If people have acne, the number matters. The intensity matters. How big and cystic and scarring it all matters. Tea tree oil at 5% gel demonstrated good anti-inflammatory and antibacterial capacities, leading to a significant reduction in inflammatory lesions of pimples. 46% papules, pustules, 47% in a double-blind, random controlled trial on subjects with mild to moderate acne, and they only used them for 45 days. The trial also showed a significant decrease in the number of comedones. These are whiteheads, big cystic pimples. Tea tree oil, 5%, proved to be 3.55 and 5.75 times more effective in reducing the total number of lesions and the severity of acne, respectively. Regarding safety, tea tree oil. Okay. More adverse effects were reported in the tea tree oil group compared to placebo. Placebo was nothing. So they saw some things. They saw some pruritus, itching, burning sensation on application and scaling. However, their incidence was low and topical application of the 5% gel may be considered tolerable. Like tea tree oil, they report, lavender oil has antibacterial, antioxidant, and anti-inflammatory properties due to its wide variety of constituents such as mono, sesquiterpene, and phenolic acids. And the effect of concomitant use of tea tree oil at 3%, together with lavender oil at 2%, by the way, both of these are in my cosmetics, on acne vulgaris was evaluated in an experimental pre-test and post-test. The results showed a significant result in the decrease of inflammatory lesions and the colonizing of lesions by the bacteria called C. acnes. The decrease in non-inflammatory lesions and the total number of lesions was significant in both groups. This group also presented a significant reduction in sebum excretion rate, how much pus in the whiteheads they're making, or blackheads. Then they did a comparative study with tea tree oil and lavender, and they did a design to compare it against a drug that your dermatologist will recommend for acne called erythromycin cream at 3%. Then they did 3% tea tree oil, propolis extracts at 20%, and aloe vera leaf juice. This formulation demonstrated a significant reduction in the number of comedones, papules, and pustules when they took erythromycin and combined it with tea tree oil, propolis, and aloe vera juice. The total number of acne lesions, the topical formulation developed for the study was more effective in reducing erythema scars than erythromycin. Erythromycin is this drug. They put it in a cream and they apply it to the skin and say it'll help reduce scarring. But what they found was tea tree oil, propolis, and aloe vera, all of which are in my cosmetics, my clear skin moisturizer, and my clear skin cleanser. Those ingredients are in there for that reason, to help reduce scarring and heal the body. Aloe vera from Burp F also has the antibacterial, anti-inflammatory, and antioxidant properties, as well as moisturizing properties that appear to be beneficial in treating acne.